Standards of care and measuring performance in nurse practitioner practice. Presentation provided by Group 5, Nursing 582, Advanced Practice, Nursing. Group members include Jennifer Midgett, Rachel McBride, Lauren Richard, Leah Trahan, and Kristen Veillon. As nurse practitioners, it is imperative to understand the guidelines and standards that shape and dictate our practice. Practicing without knowledge of these guidelines is like giving medicine without knowledge of the 5 rights of medication administration. It can pose a threat to both the patient and the practitioner. This presentation will discuss 2 very important concepts pertaining to nurse practitioner practice: the standards of care and performance measurement. What are the standards of care? The traditional definition of standard of care is this: such reasonable, ordinary care, skill, and diligence as used by practitioners in good standing in the same general type of practice in similar cases. This definition, however, leaves lots of room for personal interpretation and lacks specific guidelines. So what are the standards of care? The written document from the American Academy of Nurse Practitioners discusses specific standards and expectations for nurse practitioner practice. The AANP process for standards of care is very thorough, and it addresses the following topics: assessment of health status, diagnosis, development of a treatment plan, implementation of the plan, follow-up and evaluation of the client's status, care priorities, interdisciplinary and collaborative responsibilities, accurate documentation of patient status and care, responsibility as patient advocate, quality assurance and continued competence, adjunct nurse practitioner roles, research as a basis for practice. Particular organizations may have their own standards for care for their practice. Nurse practitioners must be aware of these as well as the ones issued by the American Association of Nurse Practitioners. How is NP performance measured? In any area of practice, there will always be a need to evaluate provider performance. Without continued reevaluation, there is no means to improve performance. Estimation of the value that provider brings to the company is determined by performance evaluation. No single specific method by which performance can be measured for all practitioners in all scenarios is appropriate. Performance may be measured by productivity, utilization, and patient satisfaction, as well as the quality of clinical decision-making. Performance quality is difficult to measure as it depends on both the setting and the personal perspective. Productivity may be measured by the total number of patients an NP can see per day at one office. However, productivity may be measured by a higher number of higher level billing procedures at another office. Quality care might be determined by patient satisfaction scores. Ultimately, the measure of performance depends on what each organization considers valuable to their practice. Some organizations may use a number of these factors to determine performance quality. Who monitors nurse practitioner standards of care? In the past, these standards of care were created by medical and nursing staff, developed by clinicians, and monitored by the following groups: professional societies, state legislatures, licensing boards, accreditation commissions, including the Joint Commission, judicial systems, employers, and consumer-oriented or government agencies. However, the standards of care are now being set, modified, monitored, and publicized by certain self-appointed consumer agencies as well as government agencies, to include the NCQA, the Joint Commission, and the AHRQ. As one of the organizations responsible for monitoring standards of nurse practitioner care, the American Academy of Nurse Practitioner provides standards for several areas of practice, including the assessment of health status, diagnosis, and treatment plan development, plan implementation and follow-up evaluation, prioritizing healthcare, collaborative measures, accurate documentation, quality assurance, and patient advocacy, nurse practitioner competence, adjunct roles, and participation in research. Another organization responsible for the monitoring of nurse practitioner standards of care is the state legislature. The state legislature ensures that the standards of care represent laws passed by the legislature. The Louisiana Association of Nurse Practitioners advocates and updates nurse practitioners with the new/changed laws to nurse practitioner practice. This provides nurse practitioners with current happenings and changes to standards of care through healthcare policy updates, in news and in email notifications. This resource is the lifeblood of many nurse practitioners for the ability to maintain updated standards of care and practices that have been changed through the state law. One of the most prominent agencies in the monitoring of nurse practitioner standards of care are licensing boards. The State of Louisiana Board of Nursing handles licensings of nurse practitioners in the state of Louisiana, provides prescriptive authority for these nurse practitioners, and also provides written rules and regulations regarding the standards of practice that are easily accessible online. The aim of all licensing boards is to uphold the laws of the state legislature and enforce standards of the Nurse Practicing Act. They do this by ensuring that licensing and qualifications maintain current status, by following up and investigating any complaints, and by investigating negligent or malpractice cases and monitoring and investigating any issues. Accreditation commissions. The primary commission is the Joint Commission. The Joint Commission provides accreditation to hospitals, health plans, and clinics. At this time, it is on a voluntary basis for nurse practitioners and clinics. However, it may be required in future practice. Also, being Joint Commission accredited is synonymous with having a good business practice. It allows consumers to understand that you have met the standards of care and provides reassurance that you're going to offer them with excellent standards and practices. The judicial system. The judicial system is only applicable to nurse practitioner practice if an injury occurs from care and a lawsuit is filed. At that time, the judicial system will weigh the standards of care and decide whether there has been a violation or whether there has not been a violation. The standards of care affirmed during cases in court of law will be applied to all future cases and decisions regarding the same standard of care. What this means is that whatever the court decides as the appropriate standard of care will be maintained as the appropriate standard of care for that case and every case past that, which makes the judicial system the ultimate final authority in standards of care. Employers. For the most part, nurse practitioners' performance will be based on the decisions, on the evaluations performed by employers directly. Most of these evaluations will be based on outcome measures such as quantity or quality of patients seen, patient satisfaction, reimbursement rates, things that directly impact the company, the business, and its ability to provide care. Consumer-oriented and governmental agencies. The National Commission for Quality Assurance, the Agency for Healthcare Research and Quality, Medicare, are some of the consumer-oriented governmental agencies that provide standards of practice using performance standards, patient satisfaction, and disease treatment options. Remaining up to date with standards. This is a crucial part of nurse practitioner practice, and maintaining an up-to-date standard, an up-to-date status with the standards will protect nurse practitioners and patients. Over the years, there have been many ways to do this. Some of the traditional methods include books, newspapers, and academic journals, websites to include Medscape, Hippocrates, Guidelines.gov, and the Louisiana Association of Nurse Practitioners. This also includes continuing education seminars, collaboration with other professionals, and this is aided in becoming a member of professional organizations such as the American Association of Nurse Practitioners and the Louisiana Association of Nurse Practitioners. To find more information on new or changed standards, there are audit tools by MCOs, accreditation guidelines, the NCQA, the AHRQ, state laws, and also the Louisiana Association of Nurse Practitioners. Defining performance of a nurse practitioner. As the nurse practitioner role is becoming more evolved in society, it requires a greater need of understanding of the role, in addition to defining standards. Standards of practice define the role of the nurse practitioner and are measured by one's employer, patients, insurance companies, and organizations. Measuring the quality of one's job, defined by standards of practice, provides the practitioner with a set of guidelines or rules for practice to ensure patients are receiving the safest and best quality of care. Important instructions such as did the nurse practitioner provide the appropriate type of care in a timely manner are important qualities that a patient, employer, and auditors investigate to determine the performance of a nurse practitioner. According to Buppert, the quality of care can be assessed by asking a few general questions, such as, did the clinician do the right thing? Was the care effective? Was care given in an appropriate time frame? Was the outcome as good as can be expected given each patient's condition and personal characteristics and the current state of medical science? Employers, patients, auditors scrutinize these questions, and depending on the answer to these questions, it ultimately impacts the patient and the care they received, in addition to reimbursement for services. Patient satisfaction is a major key point to keep in mind as a healthcare provider. Although some patients evaluate performance of a nurse practitioner based on non-clinical aspects of care, a patient's rating of a provider is a significant consideration. There are multiple measures of performance that are assessed when evaluating the role of a nurse practitioner. One's productivity is dependent on individual definitions of success, defined by who is conducting the measuring of the performance. As a nurse practitioner, an independent goal defined by oneself or employer, such as a physician whom one has a collaborative agreement with, might be defined as a set number of patients seen per day. On the other hand, a successful definition of performance can be defined as a limited number of patients transferred to the emergency department or hospital. In the role of the nurse practitioner, there are multiple definitions of performance. However, standards of practice must be adhered to, and care provided to patients must always be what is in the best interest of the patient. The primary goals to achieve in measuring the quality of performance are effective, safe, efficient, patient-centered, equitable, and timely care provided. Multiple measures of performance. Housekeeping measures include such things as clear labeling of allergies, initialing and dating of laboratory results, patient name on every page, and a completed problem list. It is discussed that although these are minor assessments audited in a nurse practitioner's chart, there will be changes defining outcomes that will require future auditing. As a part of the nurse practitioner's role, it is important to be knowledgeable of the several organizations that have defined performance measures, such as the National Committee for Quality Assurance, Health Plan Employer Data and Information Set, Centers for Medicare and Medicaid Services, the Joint Commission, Agency for Health Care Research and Quality, Managed Care Plans, and state health departments. The emphasis of evidence-based practice care is evident through defined performance measures that are developed based on an area of specified interest and need of careful follow-up on performance. The purpose of organizations defining measures is to provide patients with safe and effective care. As patient satisfaction is a major focus of quality improvement, Boyce and Brown emphasize the usefulness of focusing on patient or intervention level sources of variation in outcome if the full potential of patient-reported outcome measures is to be realized. These organizations will be discussed in further detail in the upcoming slides. As the acceptance of understanding of the nurse practitioner's role evolves, much research has been performed to evaluate the quality of care and patient outcomes provided by the nurse compared to physicians. In Stanek, Hutt, et al., it is discussed that care provided by nurse practitioners results in better outcomes or equally compared to those provided by physicians. There are many comparisons between physicians and nurse practitioners. Many individuals are unsure of the difference. Some refer to a nurse practitioner as a physician extender or a non-physician practitioner. The uniqueness of this role of the nurse practitioner is the background of nursing with the additional knowledge of diagnoses and management of medical conditions. As previously discussed, patients' perceptions and rating of a nurse practitioner impacts performance measures. As an employer mandated by organizations, a peer review can be performed according to a defined time frame to evaluate the nurse practitioner's performance. Another aspect of the nurse practitioner's performance is the utilization of consultations, emergency room departments, and hospitalizations. The NCQA, along with other experts, has produced the Health Plan Employer Data and Information Set, which is one of the most widely used healthcare performance sets in the United States. The HEDIS specifically defines healthcare measures and is used by most healthcare plans to evaluate performance. One of the purposes of the performance measures is for patients to compare healthcare outcomes and to choose a provider or organization that best fits their needs. As an employer and provider, reports based on performance measures can be utilized to improve outcomes in the care and services provided. Measures include the HEDIS, include topics such as asthma medication use, persistence of beta blocker treatment after a heart attack, controlling high blood pressure, comprehensive diabetes care, breast cancer screening, antidepressant management, childhood and adolescent immunization status, and child and adult weight BMI assessment. The Joint Commission develops standards to be adhered to and are considered the gold standard in healthcare. The accreditation program is voluntary. However, hospital accreditation has become synonymous with staying in business. Health plan accreditation is also becoming a business necessity. Information obtained by the Joint Commission is of public use for evaluation of healthcare organizations' performances on adherence to standards of care in relation to positive patient outcomes. The purpose of reimbursement and cost-effective safe care provides to patients. CMS evaluates the set standards and measures of performance of these indicators to evaluate the outcomes and effectiveness of care received by consumers. As high-quality, cost-effective care is a high priority for consumers, it is of utmost importance for organizations such as CMS to evaluate healthcare outcomes to determine the effectiveness of care provided and successful patient outcomes. The Agency for Healthcare Research and Quality Assurance is a government agency with the mission of improving quality, safety, and efficiency in healthcare. The AHRQ focuses on various aspects of quality such as prevention quality indicators, inpatient quality indicators, patient safety indicators, and pediatric quality indicators. The primary focus of quality indicators emphasizes safe, cost-effective, and evidence-based practice provided to patients for successful outcomes. It provides the public with a reporting system to determine how well an organization or provider is performing their job and meeting the standards of care. Part of the role of the nurse practitioner is staying up to date on current information. Outcome measures are continuously changing as a result of research and evidence-based practice. Reading newsletters and books, becoming a member of a professional organization, researching professional web resources, and attending professional conferences specific to area of interest are a few sources of information to learn the most current facts. A nurse practitioner can utilize a template to guide them during a patient encounter to ensure all areas are addressed that the nurse practitioner will be evaluated. Different measures of productivity may be looked at depending on who will be measuring performance. Advancements in technology as well as reimbursement organizations define performance measures that can be alerted to the nurse practitioner when performing their charting on topics that need to be addressed during the visit. Some electronic medical records are programmed to prompt clinicians to address health maintenance. A major focus of healthcare is health promotion and prevention in patients. With the primary focus on patients, it is part of the nurse practitioner's job to remain updated on performance measures that will be evaluated to effectively perform their job, ensure patient satisfaction, and quality improvement. In conclusion, standards of care are the predetermined course of action deemed to be appropriate for a specific patient with a specific medical need. Some of the standards of care include obtaining an accurate history, performing a thorough examination, formulating a plan, and following up to evaluate outcomes. The standards of care are enforced by multiple agencies, including licensing boards and legislative branches. Performance measures are as important as standards of care in the provision of adequate care. Performance measures include determining whether the clinician provided the appropriate care in the appropriate time with the appropriate measures. Performance is measured by many agencies, government and non-government. The measurement of performance is vital to the assurance of quality healthcare provision. Thank you for your time and attention during our presentation. We have prepared a few questions for you. Which of the following organizations does not play a role in performance measurement? A, the AHRQ, B, the NCQA, C, HEDIS, or D, the LANP. Also, a scenario question. An NP has assessed a patient, performed the appropriate diagnostics, history, and physical to determine the diagnosis of early HIV infection. Please list 2 sources for the nurse practitioner to visit to determine current standards of care for early HIV, so the NP can develop an appropriate plan of care for this patient. And lastly, true or false, the legislative branch develops standards of care. The answer to question number 1 is D. While the LANP provides valuable information regarding current standards of care and recent changes to standards, it does not provide performance measures. The NHRQ, the NQCA, and HEDIS are all performance improvement agencies. Question number 2. Some of the resources available for standard of care information include, but are not limited to, UpToDate, Epocrates, Medscape, AHRQ, the LANP, and guidelines.gov. And lastly, false. While the standards of care are developed and evolved by clinicians and government agencies such as the AHRQ, Medicare, and Joint Commission, and the NCQA, the legislative branch has no role in the formulation of the standards of care, only the implementation and enforcement.